Well, 12 May marks International Nurses Day. The day acknowledges the pivotal role of nurses and community healthcare workers globally, with the global theme, Nurses, a Voice to Lead, a Vision for Future Healthcare. The International Council of Nurses, ICN, says that the focus this year is centered around strengthening innovations in nursing in a quest to efficiently shape the future of healthcare worldwide. Well, as nations around the world grapple with COVID-19 pandemic, the World Health Organization has declared the year 2021 as the International Year of Healthcare Workers. For more on this, we're joined by Chief Executive Officer of International Council of Nurses, Howard Catton. Mr. Catton, thank you so very much for joining us. He joins us now via Skype. Thanks for your time, sir.
Good afternoon and happy International Nurses Day to you.
Well, I'll pass the message to my grandmother, who is a nurse. Thank you so much. As a start, especially at this time when nurses are essentially risking their lives on the front lines, let's talk about the importance of commemorating International Nurses Day. But over and above just sort of commemorating the day and the two of us having these conversations and acknowledging the pivotal role that is played by nurses, what more can be done to sort of alleviate some of the stressful conditions that we've watched, especially during this time that our worst nurses work under? I mean, I've been watching some of the visuals coming out of India recently, and just some of the ways that these nurses have had to decide, who lives and who doesn't. I mean, it's terrible times, of course, but how do we start to alleviate some of their stresses?
Look, you're right. I think that the world has seen the phenomenal job that nurses have done in the fight against this pandemic, but it's come at a cost. It's taken a really significant toll, not just in terms of people being physically exhausted, but the mental health pressures, people who are burnt out, who are anxious, people who are suffering post-traumatic stress disorder. And you mentioned India, nurses who, because there is limited equipment, whether it's ventilators or beds or oxygen, literally having to make life and death decisions. It's not the people who fail to act to properly prepare our health systems who have to make those decisions. It's nurses, it's our frontline health workers. The risk is here that we risk losing those workers who leave the profession because they can give of no more. It is vital that we protect our health workers and we invest in them. They need decent pay, they need safe working conditions, we need money to go into educating more nurses, we need mental health support, and we need nursing leadership.
Yeah. Let's talk more about the global theme then this year of International Nurses Day. Nurses, a voice to lead, a vision for future healthcare. I understand that the focus is on strengthening innovations in nursing. How so? And what are the plans that are in place to perhaps do so?
So we've seen the weaknesses, the fragilities, the lack of preparedness in our health systems. Nurses have seen that up close and personal, but it's not that they see what hasn't worked. They're bringing forward many of the solutions. I mean, for COVID, nurses have been at the forefront of proning patients. They're coordinating care. They're doing the liaison with families. They're crucial to the public health messages because they are so trusted by the public as well. But when we then look around the world, do all countries have a chief nursing officer to advise? Only about half of countries have that position. And even in countries where there are senior nurses, experienced nurses, we've found that they are not consistently being included and involved in the big decisions. And frankly, we can't see how you can get the big health policy decisions right, the work that needs to be done to rebuild our health systems, if you haven't got nurses at that table, seated at that table, and giving their advice and bringing their expertise.
Yeah. To continue talking about the pandemic, I mean, the World Health Organization did release the first ever State of Nursing report around this time last year. Let's talk about some of the main findings of that report. I mean, it's interesting that you talk about the fact that they're not at the table with when those big decisions are made, when they're the ones that would essentially be able to add more to the conversation. But also importantly, what I want to discuss on the back of that that report and what the important findings were is if in the past year, if any of those issues or some of those issues or challenges that were identified have been addressed. I mean, it's only been a year, of course, but have some of those that were identified been addressed in any way?
So listen, you're right, I think, firstly, about nurses not being at the table. There's often an attitude that nurses are the deliverers of healthcare.
Yeah.
Of course they are, but they're also the designers. They need to be the architects. We went into this pandemic 6 million nurses short. That shortage of nurses in many ways is emblematic of the weaknesses in our health systems generally. Work that we've done from the International Council, I have to say, and I'm sorry to say, but I think the situation has deteriorated. All of those pressures that we talked about, I think we're seeing a COVID effect on the nursing workforce. And actually, we may have to replace up to 10 million nurses over the next few years. How do we do that? Yes, we need to educate more nurses, but that will take 3 or 4 years for people to come online. I think that we need to do much more to retain nurses we have. This isn't just a numbers game. These are nurses who are highly experienced. These are nurses who they instinctively know when things are going wrong in healthcare. They hold the quality bar very, very high. They need to be respected and valued, and the voice at the table is part of that. But they also need fair pay and decent working conditions. These aren't nice to have. Yeah. These are things which are absolutely essential to having strong health systems. When I talk about strong health systems, it's people, it's nurses, it's other healthcare workers.
Yeah. It's interesting that you talk about the fact that, we went into this pandemic 6 million nurses short. And one of the things I wanted to talk about was whether or not, we're facing an aging nursing workforce. I mean, I'm sure you know that not many young people are sort of going into nursing. And what was very sad for me is that some of the young people that are going into nursing are going into it out of maybe desperation and not necessarily a passion or a love for it, as people like my granny would have gone into nursing because of a love of what they do. And I'm wondering if that's adding also to the crisis. I mean, what does this then mean for the nursing force in South Africa? You're saying we'll reach a point where we need to replace about 10 million nurses, and I wonder if that is at all possible. I mean, I'm sure that's true, but I wonder how possible it is, especially if we look at the South African context.
A couple of things there. You're right that in some parts of the world, the nursing workforce is older, it's aging, they're going to retire sooner. Yeah. That tends to be in a lot of North America, European countries. In other parts of the world, Africa being one of them, the age of nurses is often younger. A really worrying dynamic is how those nurses from higher income countries, a way to replace the nurses who are aging and may be leaving is to recruit from lower income or middle income countries. And that could actually make the situation worse. So this issue around the migration of nurses around the world is a key policy issue that needs to be tackled. If every country aim to be self-sufficient in the supply of their nurses, that would help with that. In terms of interest in the profession, the jury's out a bit on this at the moment. Mm-hmm. There are some places where we're seeing an increased interest in nursing. People are looking at how nurses have responded. And if you're looking for a job where you are absolutely going to make a difference to people every day you go to work, nursing's the job for you. But also, we're seeing people who look at the experience of nurses, the lack of protection. Nurses around the world, runs into the millions who still haven't had a vaccine as yet as well. Yeah. Some of the abuse and victimization, and actually say, this looks like it could be one of the most dangerous jobs in the world. If we go back to protect, support, and invest, that's going to help both recruitment and retention. Yeah,
I'm being told to wrap up the conversation, but very quickly, what's your message this afternoon then as we celebrate International Nurses Day to the nurses out there, especially when, some of them might be really having low morale at this time. I mean, they must be tired. Some of them are ill. Some of them have to watch their colleagues dying really because of COVID-19, because of this pandemic. I mean, what is your message then today?
I want to give a positive message. The world has seen the true value of nurses. Yes, they've seen how difficult and challenging it is, but they've seen nursing courage, compassion, they've seen nursing leadership, they've seen the complexity as well. Nurses out there are changing individual people's lives on a daily basis. They're making the world a healthier place. I think they're making the world a more equitable place, but the world is also changing its view about nursing, and we need to push on here. You're part of a family of 27 million plus nurses around the world, and we're going to work with you and make sure that you have the leadership roles that you absolutely deserve, as well as the support and the protection that goes with that.
All right, Howard Catton, an absolute pleasure speaking to you, sir. Thank you for being with us here on SABC News this afternoon.